So I am Romaric LOFFROY. I am professor of interventional radiology at Dijon University Hospital, and I am an interventional radiologist. So varicocele is a dilation of the pumping, what we call the pumpiniform plexus, which is the venous network around the testicle, and this is like a varix around the testicle. They are due to an incompetence of the valves of the spermatic vein, which are supposed to drive the blood from the testicle to the heart. And in that case, there is an incompetence, meaning that you will get some stasis of the blood upstream, and then progressively a dilation of the venous network around the testicle, leading to a varix around the testicle. Two main consequences. This varix can lead to pain or discomfort. This is one of the main symptoms. And the second one is you can get altered spermogram and couple infertility, because we know that there is a link between the presence of a varicocele and potentially alteration of the spermogram. No, all patients with a varicocele are not sterile, but it can happen. The different hypotheses, the main one is that this varix can warm up the testicle, and from a pathophysiological point of view, it can alter the spermatogenesis. So we know that in the general population between 20 and 40 years old, the incidence of varicocele is high, between 15 and 20%, and it can increase up to 50% in the same population with altered spermogram, meaning that there is really a causality link between the presence of varicocele and potentially altered spermogram. The main treatment to treat varicocele is to perform what we call an embolization of the spermatic vein, meaning that we have to occlude by endovascular approach, by venous approach, the spermatic vein, usually the left spermatic vein, with some material, especially glue. And this is a harmless procedure, which can be done as an outpatient procedure under local anesthesia. This is very easy to do and very efficient for both symptoms, pain and altered spermogram, and to improve as much as possible the spermogram. My recommendation with this disease would be because I see a lot of men who know that they have a varicocele for a long time, sometimes since childhood, and they never did anything about that because they are okay with this. And I see them at 30 years old because of couple infertility. So I would say that my recommendation would be every time you feel something around the testicle, and even if it's not very painful, to see a doctor and to treat this varicocele with embolization, which is very easy to do, to avoid to get couple infertility a couple years after.